Huntington's disease is a neurological condition, and what happens is that some cells within the brain, in selected areas of the brain, become sick and then eventually die.
My mum had Huntington's and she'd been ill for years, and I just wanted to find out and find out whether I have today or not, and I did.
Well, to have Huntington's disease, you've got to have a mistake in a specific gene. It's a condition which affects basically movement, thinking processes, and can often lead to periods of depression.
And so I've had the symptoms about 3 or 4 years now. I've become a lot clumsier of late. Started twitching a bit more of late. Right shoulder once again. When I become stressed, I tend to mumble a bit and now and again. And also stress, that's a big one. It can be anything though, absolutely nothing, and it'll set me off. So
what you're seeing is basically a progressive neurodegenerative disorder and problems with the musculature.
Seeing what it did to my mum, I think it's laid the foundations for myself. I'm clumsy anyway, dropping stuff is part of my life before I got Huntington's anyway. So I'd be like always wondering whether I couldn't do that.
The majority of people who are at risk choose not to be tested, but since the gene was identified, it's become a relatively easy laboratory test to measure the size of the gene.
I'm obviously understand that there are other people who, can't find out. I mean, our family's all split about. There's my brother and sister who, have different views on it. My sister found out, and she's obviously got it. So, yeah, I can understand my brother not wanting to know as well. It's hard to say. I was almost bordering on positive that I didn't have it, and then I did. It was a bit of a shock.
It is important that if patients are having problems with depression or irritability or aggression, that those are treated actively using the standard drugs that would be used for any patient with those kinds of problems. You can involve physiotherapists, you can involve speech therapists if they're having problems with their speech or having problems with their swallowing.
I'm not sure that I'm going as bad as my mum did. She bordered from any time she could be normal from, but at the same time she'd just flip to going into, she could be going into quite a nasty rage at times, and she ended up being by herself with no one, and that's no way to go. My biggest fear at the minute is forgetting people. I know that's my biggest fear really, is not being able to talk to people or maybe not remember people.
As far as it goes, there's no effective treatment to stop the underlying problem within the nerve cells of the brain. So the treatment is effectively symptomatic and supportive. I rather think of it as a long illness, and the needs of the patient change over the course of the illness. And so the sort of help that they require changes over time, and sometimes they need to see different specialists at different times in the illness.
My wife Lisa, she's my rock, she is. She helps me day to day, keeps me going if I ever start to wonder for any reason. Little things, it's really little things, it really is. I try and keep as upbeat as possible, and I think that's helping me in a way. I really do. I think being positive about it and not trying to hide it, and it's helping me anyway a lot. So I think that's the best way. I do, really do. Don't let it bring you down. It's bad enough that you got to face it anyway, without it winning and bringing you down.
For more information, visit www.nhs.uk.